cannot come soon enough for the elderly. In Washington state, 7 residents of 3 different long-term care facilities died from coronavirus after health officials say that staff members attended a large wedding and then tested positive. Another tragic reminder of how long-term care facilities have been the hardest hit and the most vulnerable throughout the pandemic. And there's also a new report out by the American Health Care Association showing a new wave of cases and deaths is hitting these facilities right now. They warn a 1-month delay in distributing the vaccine to nursing home residents could result in more than 10,000 preventable deaths. Joining me now is Mark Parkinson once again. He's the president and CEO of the AHCA, which represents over 14,000 long-term care facilities across the country. Mark, thank you for coming back in. The situation with nursing homes, I have to say, has gotten quite a bit worse since we last spoke, and that was just a few weeks ago. What is happening?
Well, unfortunately, as community spread has really ravaged the entire country, the virus has found its way back into nursing homes and assisted living facilities. And in fact, there are now more cases in the buildings than there were in the spring. We thought the spring was the all-time worst that it could get. We now have about double the number of cases. And unfortunately, we're coming close to double the number of deaths, all of which underscores the incredible importance of getting the vaccine out as quickly as possible.
Absolutely. Oh, that's so tragic to hear that it's even worse than, I mean, I couldn't imagine it actually being worse than some of our conversations in the springs and the stories coming out. So Mark, what do you think when you see these vaccines rolling out in the UK? I was just talking to Max Foster, the first shot going to a 90-year-old woman.
Yeah, I mean, it's so great to have a good story, and Margaret Keenan and William Shakespeare, sort of 2 classic English names. It puts a nice twist on the whole thing. But it's incredibly encouraging. It's going to give us about a week or 2 glimpse at the impact on the long-term care facilities that get the vaccine. The UK has made the right decision, and they're targeting those facilities first. So we're going to learn a lot over the next week or 2 as they distribute the vaccine, and then hopefully it starts getting distributed in the United States in these facilities just in the next week or 2.
And I did want to ask you, just to put a fine point on it, you know, the chief scientist for Operation Warp Speed told CNN that the vaccine rollout here in the U.S. will significantly reduce elderly deaths. He says by the end of January. How big of an impact do you think it will have in a month?
If the public health officials make the right decisions, if the governors make the right decisions, we can cut the death rate by 40%. But that is only if long-term care residents and the staffs in those facilities are all vaccinated with the 2nd dose by March 1. That's the challenge that we're making. Let's get everybody vaccinated with the 2nd dose by March 1. If we can do that, the death rate will be cut in 40% because 40% of the deaths are occurring in those facilities. It will be hard to do it. Distribution is difficult, the logistics are difficult, but if we as a country pull together, we can get this done.
Look, and for folks at home, you know this on multiple levels. You are also a former governor. I mean, when you were governor, you had to take on this massive operation of distributing a vaccine in this way. But what are you hearing from state governors about how they plan to get these vaccines to long-term care facilities? Are you confident? Are you feeling good about what you've heard so far?
The CDC decision last week to elevate long-term care residents to the top tier has made an enormous difference. And we believe that virtually every governor has made the decision to prioritize the long-term care settings. It looks like they're making the right decisions. Unfortunately, it will be hard to execute the decisions because it's really tough to get this vaccine out into buildings, particularly in remote parts of their states. We're encouraging every governor to really just focus on this in a very specific way, and if they do it, they can get this done. If they don't do it, if they just kind of let this happen naturally, the vaccination in these facilities will be delayed and more people will die.
Yeah, it is real. That is not hyperbole, and from our conversations, we know this too well. Do you have a sense, Mark, of if residents of the long-term care facilities are how accepting, how open they are to getting the vaccine? Are you hearing any resistance?
We aren't. You know, there's polling that shows that in the general public, about 40% or so of the public is concerned and may not get the vaccine immediately. But in our discussions with our residents, we don't think there's going to be that kind of hesitancy. Unfortunately, these residents have seen the tragedy that occurs when older people get the virus. Many of them are terrified and nervous of getting the virus. So we think there's going to be wide acceptance of the vaccine once we can get it into the buildings.
Yeah, it's it's entirely a reality that they are dealing with on a daily basis. It's not something theoretical at all, or stories or news reports. They know it too well. Mark, thank you for coming in.
Okay. Thank you.
Coming up
Really
coming up.